Okay, let's start discussing a diagnosis for this patient.
Alright, what's his name and background?
His name is Gregory House. He's a 54-year-old white man who is currently employed as the head of diagnostic medicine at Princeton Plainsboro Teaching Hospital. He also has had a known addiction to Vicodin.
Do we know how that started?
Yes. He suffered an infraction in his right leg during a golf game, which went undiagnosed for several days. He eventually had a dead muscle bypass to restore circulation to the rest of his leg.
What do we know about his personality?
We know he doesn't have a clean history. He was expelled from Johns Hopkins School of Medicine for cheating on a test. At one point, he checked himself into Mayfield Psychiatric Hospital, where he began hallucinating from his illegal drug use. He also has had numerous complaints filed against him from patients and coworkers.
What were their complaints about him?
I have some on record here.
How did you like having Gregory House as your doctor?
I was lucky to have him, but he was very rude and impersonal. He got the job done, but I hardly saw him during my 3 weeks stay.
What do you think of Dr. House's character?
Well, I think he's an excellent physician, but his bedside manner could use a little improvement.
What theory would best explain his personality and neurotic behavior?
It could be due to his abusive dad during his childhood. Sigmund Freud's 5 stages of development best explains this, mainly the anal stage, which best explains why he has an obsession with problem solving, which means he was disciplined too hard during this stage.
What would you attribute to his current problems?
His addiction to Vicodin is primarily his issue. However, the way he treats other people and the way he acts around his patients make it seem as if he has a narcissistic personality disorder. House is antagonistic and has a very hard time trusting other people. He takes this anger out on those around him to some extent and thinks that he's better than his peers.
Let's take a look at this clip.
Look at her arm.
I told you it was an infection.
We fixed the infection.
Well, apparently not. I asked you for broad spectrum. You put her on the bare minimum. It's a good thing you failed to become a mom because you suck at it.
I have this room booked from 2 to 3.
Oh, to East Coast time. I thought you meant Pacific, which is stupid of me, I guess. What about parasites?
Stool sample is negative.
It's 2 o'clock.
Oh, well, we should go then. It just leaves cancer. Get a lung biopsy.
Well, it took a half an hour to get the mask on the kid for the lung scan.
Oh, I'm sorry. Was there somewhere you needed to be? You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Jerk.
You would just get the elf jokes this time of year.
No on trauma. Negative PPD. What flavored dwarfs are you guys?
My daughter and I both have cartilage hair hypoplasia. Think you can make a pun out of that?
Yes, but I don't want to be insensitive. She's got a bit of a short fuse, isn't she?
What would be the best treatment for him?
Probably psychotherapy, in particular psychosocial therapy, would be one of the possible treatments for House. Individual and group therapy would produce the best results, as well as medication to help symptoms such as depression and anxiety. Sending him to rehab may also help him getting over his addiction to Vicodin. What do you think motivates House's actions?
Probably the socio-biological approach. It discusses the person's genetic drive to survive. It can also explain motives like aggression, competition, sexual activity, and dominance. Although the theory seems to put emphasis on the person's motives for themselves, it also explains why people may sacrifice themselves for the sake of saving others and continuing the race, which is something House has been known to do throughout his career, as well as expressing his aggressive and sexual motives. What theory best explains how he expresses emotions?
Schachter and Singer's theory states that people label emotions from situational clues. House recognizes the emotions that are present around him, but has trouble identifying with them. Let's take a look.
I woke up in the wrong bed this morning.
Any bed you're in is the wrong one.
That's not what your mama said. Oh, snap. He started it.
I can still fire you if you're not doing your job.
I'm here from 9 to 5.
Because your billings are virtually non-existent.
Rough year.
You ignore requests for your consults.
I call back. Sometimes I miss Donald.
You're 6 years behind in your obligations to the clinic.
You see? I was right. This does not interest me.
6 years times 3 weeks, you owe me better than 4 months.
It's 5 o'clock. I'm going home.
You know, the only reason I don't fire you is your reputation is still worth something at this hospital.
Excellent. We have a point of agreement. You won't fire me.
Your reputation won't last long if you don't do your job. All I want is for you to do your job.
But as the philosopher Jagger once said, you can't always get what you want.
Let's talk about how culture and society has affected House.
Culture seems to simultaneously have both a large and uncommonly small effect on Gregory House. His bitter, antagonistic outlook on life is probably a result of his experiences with people in his culture. He expresses a lot of truths or near-truths about society that people usually do not want to accept. For example, when he says, everybody lies, people like talking about people, it makes us feel superior, it makes us feel in control, or when he says, we all make mistakes and we all pay a price. His culture has clearly affected his personality. On the other hand, House breaks so many folkways, mores, and laws that he appears to be less affected by culture than many. He feels less obligated to conform than most. He never wears a lab coat at his job and is often rude, insensitive, and invasive with his patients. He does not match the mold of what a doctor is expected to be like in any way.
How does House do with socialization?
House is really stubborn and struggles with resocialization. He feels like an outsider and can't assimilate into his environment or relate well with those around him. He dislikes change and his only true friend is Dr. Wilson. Do you think social structure is impacting his personality?
House seems to be largely influenced by his different social statuses and roles. His status as a doctor is obviously the one that affects his life the most. His job and his case are what matters to him most. He obsesses over figuring out his cases and trying to help his patients, regardless of the fact that he usually does not take his patients' feelings into consideration. His roles include that of any doctor. He's expected to do his job well and to the best of his ability. He's expected to help his patients, and at times it probably gets very difficult for him to handle his status and roles because of the stress put on by him, by the patients, and his coworkers.
Could be lymphoma.
Not with normal LDH.
ITP fits. We should start her on methotrexate.
Absolutely. And total body irradiation.
Because she failed the bleeding time test?
TBI will promote cancers, kill her digestive tract.
Don't forget, stop her from bleeding into her brain.
It's premature, reckless, and potentially lethal.
True. Must be somebody's job to stop me from being reckless and irresponsible. Nobody can stop me from being premature.
How have groups and organizations impacted him?
House has more secondary groups than primary groups, which is probably a huge factor in how he's influenced. He doesn't have any really close relationships, and his secondary relationships all involve his coworkers and patients. He's supposed to maintain a certain level of maturity with these people, and it is extremely hard to do that when he works with them and interacts with them every single day. He obviously cannot form strong bonds with his patients either, so maintaining relationships with people has been difficult for him.
Let's take a look at some of these leftover clips.
Got to stop the surgery. She doesn't have necrotizing fasciitis.
Oh, good.
She's got erythropoietic protoporphyria. She's allergic to light. It's genetic. Either parent could have carried it.
I know what it is. Infection fits better.
She gets worse every time she goes under surgical lights. Dad takes her outside.
Liver shot, too. She swallow a flashlight?
Stop the surgery.
Get the hell out of my way.
No, I'm...
This isn't Cuddy. Your Jedi mind tricks won't work here.
These aren't the droids you're looking for.
And everything's the leg? Nothing's the pills. They haven't done a thing to you.
They let me do my job. And they take away my pain.